Hello. On behalf of the team at the Forum for Healthcare Strategists, Judy, Debbie, Jen, Krista, and me, Daniel Nyman, as well as our partners at Monigle, welcome and thank you for joining us for today's webinar. Over the past 4 months, we've been focused on providing you with real-time information from your expert friends and colleagues across the country. For the program today, we've turned to some of the best and brightest to explore how COVID-19 can be a catalyst for a more human experience. Looking ahead, we hope you'll join us for our first virtual Healthcare Marketing and Physician Strategy Summit. It will be held August 18th to 20th and will feature many of the content-rich sessions from our original summit, plus new sessions to help you navigate beyond the pandemic. A final note before we begin. Attendees are participating in listen-only mode, but you can still ask questions. Simply type your questions into the question and answer pane located on the bottom of your screen at any time. At the end of the presentation, our speakers will answer as many questions as time allows. With that, I'll turn the program over to Gabriel Cohen, Chief Marketing Officer for Monigle. Gabe?
Thanks, Daniel. Good morning, good afternoon, everyone, depending where you're calling from. I'm Gabriel Cohen, the CMO of Monigle. I think this could be a first for the forum, where we have 66% of the panel being European, and only a third being US centric. So I thought we'd start maybe with the minority here in the group. And Jim, why don't you give a quick intro about yourself and Hackensack Meridian Health, and obviously and tell us how you're holding up. How are things today over there?
Thank you, Gabe. It's good to be with you and be with everybody. Jim Blazar, I'm the Chief Strategy Officer at Hackensack Meridian Health in New Jersey. We're the largest and most comprehensive health system in New Jersey. And we were literally in the epicenter of the first wave when you heard mostly probably about New York. We were right with New York, particularly our flagship hospital, Hackensack University Medical Center. Collectively, at the peak of our spike, we were treating 10,000 patients across our network, 2,600 inpatient across our 14 acute care hospitals and the rest on an ambulatory side. We're holding up much better today, and we're watching what's going on around the country, and hopefully people can bend the curve in other states as we have. We're down to an infection rate in New Jersey of about 1.1%. And we just hit a milestone yesterday of having only 84 patients across our network. We were in the hundreds, and we made it down into the 80s now. So doing very well. Thanks for asking.
Take a minute to unmute myself there. Douwe, it's not often that we get someone who is in a CMO role and with 6 months, about 6 months of experience?
4.
In 4 months. Yeah, 4 months. Yeah, no, if it was 6, you'd already know everything. Give us a bit of background on how you got from the Netherlands to Piedmont Healthcare, and how are things today over there?
Yeah, as a little boy growing up in the Netherlands, I always wanted to work at Piedmont Healthcare, and finally made a dream come true in February. All joking aside, Douwe Bergsma, thank you, Jim, thank you, Gabe, for having me join this panel. I'm honored to be a part of this, even though I'm only a Chief Marketing Officer at Piedmont Healthcare since February, which is also the first time I've ever worked in healthcare. I started my career in the Netherlands, hence my name and my accent, at Procter & Gamble, who sent me to the US for a 2-year assignment in Atlanta, Georgia, which became a almost 20-year assignment in Cincinnati, Ohio. Did many roles at Procter, and then left P&G in 2011 to become the first Chief Marketing Officer at Georgia Pacific, also here based in Atlanta. So my wife and I moved back from Ohio, Cincinnati, Ohio, to Atlanta, Georgia, or a little north of it. I was the Chief Marketing Officer at Georgia Pacific, a large paper manufacturer, largest manufacturer of toilet paper and paper towels and plates like Dixie and napkins like Vanity Fair. And then last February, I had the honor of starting at Piedmont Healthcare, which is also based in Atlanta, Georgia, and get my feet wet in the healthcare industry, hoping to bring some of the consumer marketing experience into Piedmont Healthcare's system. Piedmont is the largest healthcare system here in Georgia, although in size we're almost equal to Wellstar and Emory, who are the other two large systems here in the state of Georgia. We have about 11 hospitals, about 2,500 physicians in the network. We have urgent care, quick care facilities across the board. So very similar to many other healthcare systems across the nation. We are not over the peak. We had our first wave, I would say, in March, where we hit our height. It decreased to almost a third of our peak. And today we are about double. Well, last week we were about double of the first peak. So we went up, then we went down. We thought it was manageable. A lot of people jumped into conclusions and changed their behaviors. And then we spiked all the way up again, higher than it had ever been before. And we're right in the middle of that and dealing with that. Needless to say that we're focusing on a lot of COVID across our system. The big difference with the first wave is we didn't close everything else down. So we're basically trying to operate as normal as we can while handling the record amount of COVID patients that are coming into our system.
Well, and it goes without saying that, you know, me and just on behalf of everyone who's here, incredibly appreciative of the fact that the two of you are giving up some time in the midst of all of this, and indeed everyone who's joining as a participant. We want to make sure that the time that you're spending here, you really get something out of it, and hopefully we'll get that in through this conversation with Douwe and Jim. And we've been talking a lot about why this topic is important in the current moment. I think it's fair to say that I don't think that there's ever been a time where there have been more stories related to healthcare ever, right? We're all aware of them. And I mean, in the spirit of starting with something that is European based, I don't think there's anybody here from the Centro de Salud Ramón y Cajal in Madrid, but this has been at least one of my favorite human stories from the last few months. This was a taxi driver in Spain who basically spent a month driving anyone who had COVID for free to the hospital. And this was the moment where the hospital called him to say that there was another patient, take him home, where in reality they were bringing him in to say thank you. So these were the healthcare workers at the center in Madrid thanking the taxi driver for everything that he had done. So there are heroes everywhere, and I love this story because it almost kind of flips some of the stories that we're seeing on their heads and shows how, as a community, we're all involved. This was the doctor giving him actually some cash and the results of his COVID test, which was negative. And I thought having this example was a good preface to the conversation, again, because we've never seen as many examples in healthcare as we're seeing right now. It's the celebrations when people are recovering, celebrating reaching mile markers. So this is kind of humanity coming through in healthcare. I think that we've always known about, but Jim, I guess I'll throw it to you first. How is COVID accelerating? This idea of experience and humanity?
This idea of experience and humanity.
Journey that we're on.
Yeah, Gabe, I would say that it is accelerating, and you know, there are so many sad stories and difficult issues with COVID. There are also some silver linings, I think. And I looked at the trust index for healthcare prior to COVID, and I'm anxious to see it post-COVID. But the trust index in our market of people trusting our docs and trusting our health system and other health systems has gone up dramatically. And I think it's because it's really shown the human side of health systems. And as there's been consolidations and the way healthcare has been moving, including our network, everyone's been focused more, in my opinion, on the business side of healthcare. This brought back the human side of healthcare heroes, frontline people. And as you showed in that video, it's nurses and doctors, but it's also environmental service workers, and it's also paramedics, and a lot of people in the front line that gave up a lot and really did everything they could to take care of their communities and their patients. Right now, we're in a better place. I know in the middle of it, sees it every day, and I'm hoping that this stays. I think COVID may have changed this forever. You really had to keep looking at the human side and working together as a community to do more. Thanks for putting up this slide. Pre-COVID, Amazon and Amwell and One Medical Concierge and CVS, they were and will continue, and they're all built around human experiences way better than healthcare is. Our competitors today is this group. I think COVID may have helped us catch up to the things that we're going to need to do to be successful. The things at Hackensack Meridian Health is that we do have a Chief Human Experience Officer, Nancy Corcoran-Davidoff, and when we merged, there were two heads of HR, and Nancy at that time, they gave up a role as HR and took on the Chief Human Experience Officer. And we didn't call it patient experience on purpose. This was 4 years ago. We called it human experience because we wanted a broader view and really include everybody. And Nancy spent 1.5 years doing nothing but looking at best practices around the country, setting up our infrastructure, and then the human resource person left, and we decided that we would integrate those roles because another part of Nancy's job in human resources is looking for talent. And part of human experience is having the right talent in your organization and building a culture. So I totally agree with your premise, and I think that COVID has brought back a lot of the humanity in what we do and has shown it to all of the communities that we all serve.
Jim, can you touch a little bit more on Nancy's role and your approach to experience? Because the role of the chief experience officer, having someone experience isn't new, and probably everyone has it. But what's different about your approach and perspective and how you're looking at experience? I mean, for me, one thing that stood out was the fact that experience and HR are part of Nancy's remit.
Yeah, so I'd say a couple things stand out in terms of our approach. One is that Nancy helped build an infrastructure to support patient experience. So experts in each one of our hospitals, they work directly with the leadership teams at each place, putting tools in place so that we can do rounding and track issues. But more importantly, HR is leading the initiative on culture, and we're really trying to build a culture of experience into everybody as we get bigger and bigger. And there's a lot of advantages to scale, purchasing and other things. But when it comes to experience, it's each moment, each time with each patient and each visitor and each family. And it can't be Nancy and her team going, well, we're in charge of experience, we'll take care of that. It's distributed, and she helps set up the infrastructure, but also the culture that we're establishing. And it starts with our team members first, is that if they understand how important each one of those moments is, and COVID really brought this out, because we had patients that with COVID and they couldn't have visitors, and that's happening around the country. So someone would literally put their family member suspected of COVID, very sick, into a car or an ambulance, show up in our emergency department, and then they would drop them off and drive away. So we had patients up in our units, and our nurses and other caregivers became their surrogate families. And this is a great example of that, but it's what Nancy helped build in so that it wasn't unnatural for our nurses and caregivers to take on this role. We've been talking about this in our rounding. We've been talking about this, but this is one of our nurses being interviewed on CNN, and she's an amazing young nurse, first year, and she actually got on CNN because the family is the one that had a contact with CNN and told about their experience, their human experience, that their mother was dying, they couldn't be there, and this nurse had an iPad and brought the iPad into the room, let the family say goodbye, and she literally held this loved one's hand as the person passed. And think about this on the young life of this young nurse, and the impact on the family was so profound that they wanted to tell their story on CNN. And but this was just one example of what was happening across our network. And it isn't an unusual story, unfortunately, in America today. I'm sure it's happening at Piedmont. I know it happened in New York. I'm sure it's happening in all the hotspots around the country, is that nurses and respiratory therapists and others took on this role. And I think it's going to change us forever in that people that had to take on those roles, it's hard to go into a patient room anymore and just think about just the work that you do without thinking about the human that's in that bed. And I think it's going to end up helping us maintain thinking about the human side of what we do. I think you're on mute.
Thanks, Jim. Now, when we were having a conversation earlier this week, we were talking about the topic of humanizing experience, humanizing brands and building experiences. And it's something that we've been talking about, say, here at Monigle and with Jim and others for years. And you stopped me and said, all right, just hang on a second. How are you defining this? What do you mean? And it really kind of forced me to pause a second and think about, what do we actually mean by this? And more importantly, if you have 10 conversations with 10 different people, they're going to think about it in different ways. So being new to the industry, how would you contrast this conversation of humanizing brands and creating experiences with how you were looking outside the industry and how we're looking at it in healthcare, and how should we be looking at it, and talk a bit about the importance of aligning on definitions internally on these topics.
Yeah, I still apologize for interrupting you because you make it sound you didn't get angry when I did, but after you calmed down.
British diplomacy.
We had a good conversation. I don't think there's a big difference across industries, whether you're in financial services, the car industry, consumer goods. When we talk about humanizing, I think it overlaps a lot when people talk about purpose-driven branding or purpose-driven business. It's all in the same family. And the short version of it is you put people first, your patients or your consumers or your clients, your customers, like this. There's many words for the same thing, but the people you serve, put them first in many dimensions. And as you said, coming over from a different industry, it's very important that you kind of align and define the things you're talking to, because I might be talking about loyalty with a consumer mindset, and one of the surgeons here might have a whole different definition of loyalty. He might say, hey, listen, it's a loyal patient is somebody who's been with me for 20 years. And I'm is like, well, what is your share of wallet would be my definition of loyalty, and then you could be talking past each other. So I made it a habit to ask, well, how do you define this? And if there's not a definition, you make a draft and get alignment. Say, hey, is this how we? I had a funny one of my early discussions here is like, what is the difference between a patient and consumer? What is the definition of consumer in healthcare? And what is the definition of patient in healthcare? I still haven't gotten the answer, but because this was one of those, you ask 10 people, you got 10 answers, all from like they're one and the same to, oh, they're majorly different. And it does remind me of my shopper marketing days when at Procter & Gamble we tried to define the difference between a shopper and a consumer and a user of a brand. But for me, as a working definition on humanizing brand or humanizing brand growth, as I'm looking at this early on, is all about empowering the right people to embrace the right brand experience and orchestrate the right brand engagement with the right clinicians at the right time and the right place. I know it's a mouthful and I'm trying to define each of those words. What is the right person? What is the right brand engagement? What is the right healthcare experience? What is the right clinician? And linking it back to the strategies that the leaders that are here for a long time have defined, which is all about quality, safety, and service. And I wouldn't go into the details, but I'm trying to link the humanizing with the existing strategies and try to use those pillars as they path forward for our marketing and communication efforts.
You also had an interesting take on the importance of, if you're putting the consumer at the center within healthcare at the moment, it's also about empowering, it's also giving them more, putting them more in control.
Yes, and I do. If you really put the patient first, and you've seen it happen in many industries, but you empower them to embrace a certain engagement, like do you choose to engage with a brand, with their communication not, and you empower them to orchestrate the experience. Like how I interact with our neighbors like Delta Airlines today or before COVID is significantly different from how I used to interact with them. Way back when I didn't even interact with Delta, I would go to a travel agent to book my tickets and I would get some paper in the mail, and now I'm on my app standing at the gate changing my seat. So I have like 5 centimeters more of leg room. And I can call Delta while I'm at the gate to change my flight, looking at my app to see what the operator is doing for me. And so there's the orchestrating the experience in many industries has become much better, enabled through technology and data. And I think healthcare is going through that same evolution, if not revolution, in the coming years. There's a whole host of reasons why they're not as far developed as financial services or the hotel industry, travel, transportation. But there's also a whole host of reasons why it is more important than ever before. You could argue that healthcare is probably one of the most important industries in anybody's life, especially when you're dealing with a health issue.
So, I mean, clearly the leadership there and the CEO of Piedmont Healthcare made a purposeful decision to say, we want to bring someone who isn't from the industry to come in and bring that outside knowledge. What was the vision that he set for you for doing that? What was that remit that you was hoping to bring? And then I'd love to hear from you what kind of resistance and receptiveness you found since arriving at Piedmont.
Yeah. So obviously, Kevin Brown, the CEO, he was pretty clear that he wanted to bring somebody outside of healthcare. And I think there was a reason for doing it, and also he had the ability to do it. The reason for doing it because he wanted to bring more consumer focus, a more consumer experience into his organization, Piedmont Healthcare. And his belief was that somebody that had a long history in consumer goods, consumer branding, or consumer focused industry would be able to drive more change potentially faster. But one of the key reasons that he was able to do that is that he already had an all-star team of leaders who are very grounded in the healthcare industry. So when I arrived, it wasn't like, oh, there's all these new folks from outside the industry. It's a pretty stable leadership team that has been together for 6 years. We have a fantastic consumer experience executive, Mike Beer, who's kind of in charge of the execution of the experience itself. And who's been here for a long time, and she's been like quoted in books by Prophet. And so Piedmont was already on a journey, and I think he hired me from the outside to give an incremental boost and an acceleration to a journey that was already there. So those two things combined, a fresh set of eyes from the outside, inserting in a team that is already on the inside. From a resistance, everybody has been very receptive, but again, I'm here for 4 months, and 3 of those months were COVID. And during the COVID period, like 60% of my job was external communication and internal communication. So ask me again in a few months to see how it goes.
Yeah, that'll come.
So far, everybody has been receptive because somebody has to deal with all the journalists and the press and the media, I guess. And it happened to be me. That's
great. Jim, kind of coming back to you for a second, one of the things that we've been talking about in the context of humanizing healthcare is the fact that a lot of the stories have always been there. It's always just been a case of ensuring that we identify them, capture them, and share them. And some of the things that you were saying around how you've changed some of the communication approach within Hackensack Meridian Health during COVID has really allowed that to flourish even more. Maybe talk a bit about that, the structure, and we can kind of dig into a couple of those stories.
Yeah, what we had just launched a new brand strategy, which was Keep Getting Better. And it didn't seem that Keep Getting Better was going to work during COVID because we didn't know how people were going to get better and people were beginning to die. So we pivoted and we really focused on the stories of the caregivers. And this is, there's a picture that you're showing now. And all we did is tell patients, caregiver stories. And Tanisha is actually the woman that works in the morgue at Hackensack University Medical Center. And she, on her own, without anybody knowing this, just felt that these people were dying alone up in the hospital, and that put into a, literally into a body bag. And then our morgue was under repair, so they went into a refrigerated truck. And unfortunately, there were so many deaths, we had to get multiple refrigerated trucks. So she went and bought on her own daffodils and put daffodils on every single body bag so that it was a sign of hope, and that she was doing this for the families and for just out of respect for those that had passed. And that story got told to us and ended up in the New York Times. And as a result of that, this just shows you that we're all in this together. The story I'm going to tell is that was the first part of her story. The second part was the Port Authority of New York and New Jersey actually donated money so that she wouldn't have to buy the flowers on her own. And a family that had just gotten their check from the government when the federal government added the relief, they got their $1,200 check. They donated their money to Tanisha so she could buy flowers. So it's a community thing when you tell these stories, and she's just an amazing person. The second thing that we did is our town halls used to feature leaders in what we're doing. Our CEO, Bob Garrett, immediately said, I only want frontline caregivers. I want them to tell their stories. So this is a screenshot from our town hall, and Tanisha was on, but Cynthia was on as well. Cynthia is in environmental services at one of our hospitals, and she was telling her story about she never felt more part of a team as she did during COVID, and she never realized how important her job was until COVID, because she learned all the technical parts, but she realized families and everyone needed to make sure that those rooms were clean and that they were disinfected from COVID. And so she really felt part of the frontline caregiver team, and it just brought our entire health care community much closer together as we were fighting this virus and taking care of our community.
That's wonderful, Jim. And how does this kind of, how often were you doing these town halls? How have they been received? And maybe just kind of talk about how it fits in with the broader agility that you've gained and the layers of bureaucracy that you've removed as part of this.
Yeah, the town halls occur every week, and on Tuesdays and Thursdays, we were doing webinars, and the webinars were any team member that had a question about PPE or about policies, they could ask leaders. But on the Wednesday, we did town halls where Bob had frontline leaders. So that's continued. We've gone from once a week down a little bit because we're also now into recovery and people are doing more than just COVID. But he's kept frontline caregivers as the focus of what we're doing and telling those stories on a regular basis. So that's going to persist going forward. In fact, we had to shift because of calendars. There was a town hall today, and the people telling their stories were people that came up with innovative ideas to do a better job of caring for our patients. And I think you might actually have a shot of a couple of these ideas. One was this tree of peace. And the tree of peace was that they recognized that things just go on in units and the units can get noisy. Meanwhile, in a patient's room, someone could be very ill or passing, and it was not respectful. So they had it at the unit, if this tree of peace is lit up, they know that everyone needs to be reserved and quiet so that we can give respect to the people that are really in a very important time of need. And this was started at one unit and now is being integrated across our entire network. The second was, and this came up during COVID and persists, is the comfort cubby and compassion cubby, I'm sorry. And they realized that people were coming in and they didn't have clothing when they needed to leave. This could be homeless people, it could be a variety. So our caregivers came and donated clothing, and they created a spot where they could put that. So anyone that needed clean clothes when they left would be able to have those. And it's just an example. You asked the question earlier, how's Nancy Corcoran Davidoff? What's the infrastructure? The infrastructure is culture ambassadors and people driving this so that everyone's focused on the human experience for everybody. And I think it starts with taking care of our own team members, and then that extends into taking care of our patients and their families.
Yeah, and there's another example there. And I think that's what we're hearing more and more. It's that this is where it connects to this notion of it accelerating the humanizing aspect, and we're developing new rituals with everything that's going on that we hope will continue to drive and have any infrastructure in place. Douwe, why don't you share a couple of your stories and examples of how Piedmont Health's been, how the brand has been even more humanized, and how you've become more agile during this time.
Yes, I'm not sure what you have in your next slide. All right, that's the generic good one.
Yeah, exactly. You can go in any direction here.
I can go anywhere now. So thank you, Jim. These are great stories, and I keep being amazed about the stories that you shared and the things that you guys have been able to do at your organization. This panel experience has been as much as a learning for me as anybody else, I hope. But at Piedmont, we went through a lot of the same things that most systems around the world have gone through. And as you said, what COVID did was often amplify and or accelerate things that were already there, and they brought them just to the surface faster or better or a little bit different from what they were before. One of the things that I've observed across the board is that the appreciation and support we initially received from the community. You've all seen the visuals of people clapping and in windows at a certain time, and people sharing their thank yous. And like many other systems, we got the free lunches and we got the clothes, and but there was a few things that really stood out for me. One is that first one is we received a lot of churches and local communities that came to our parking lots and to do a caravan or a prayer, blowing their horn and just sitting there quietly and praying, or blowing their horn or cheering for the patients and the staff inside the hospital. And that was extremely motivational initially for those, because we all didn't know what was hitting us. Now, we didn't know if we had enough PPE. We didn't know if we would have enough beds. We didn't know if there was enough vents. We didn't know if we had enough staff. And then the staff that was working, we didn't know a lot about COVID. Is 6 feet enough? Is a mask enough? You have people in the media saying this is another flu, and other people saying this is the next Ebola. So those measures of support, and what we decided to do within our marketing is, on top of thanking our frontline workers, like many others, we started to thank the people that were thanking our frontline workers. So some of our ads were really about our CEO, showing these visuals. You showed a few stills. If you can go one back or two back, it's like the one with the cars. We had this happening across many of our hospitals, and churches actually had to align with each other who was coming out what weekend or what day. Obviously, this was before the wear a mask campaign, but that was the support, and this was a still from our commercials that we started airing to say, hey, we hear you, we see you, and please realize how important this is to us. We took it a step further. We got tons of donations, like Home Depot donated masks, and Aflac donated $1 million, or the CEO of Aflac donated $1 million to open an old hospital as a backup, and the CEO and founder of Rooms to Go donated $1 million. And what we started doing, making these online ads where we were thanking Home Depot and we're thanking Rooms to Go, we're thanking Spanx. Most of them were other big companies in the city. Keep in mind, Piedmont does the majority of the employees of Delta, Home Depot, Chick-fil-A, Spanx, Rooms to Go, Aflac, like all these. Like I always joke, we're the healthcare provider of some of the most beloved brands in the United States, if not around the world. But these companies have been very, very appreciative and very provided a lot of gifts. So those were two examples where you see, like, hey, we thank the people that were thanking us, on top of obviously the healthcare hero campaign that most of us have done. What's the next one? I'll talk to that.
Yeah, I was gonna. Yeah, this one. I think this is the thanking.
Oh yes. Yes, those are two examples. And what my hope is that going forward, we have that strengthened community connection ongoing, not only when there's a need. Like we're typically a large employer of the cities or the townships that we're in, so that there's a big business connection, and we're typically a large, if not the largest healthcare provider of the town or city we're in. But it only manifests when there's an emergency or a diagnosis. What COVID showed you, there's an ongoing relationship, because we have a lot of employees, like 23,000 employees. We're I think we're the 5th largest employer in the state of Georgia. And therefore we have a lot of connections, and then you add all the vendors. But we never capitalized on that, never came to the service the way it is. So my hope going forward is that we have this ongoing, we're a nonprofit, an independent not-for-profit organization. And we noticed that our gifts and our donations to our foundation has increased, and we've never been as active with our foundation as we've been doing COVID and today going forward.
Yeah, I want to share another quick example of a project we did with Northwell Health, where they challenged us to say, how can we become more engaged and be out in the community? And they're the largest system in New York City, and obviously with New York having shut down and so many of the shops having been boarded up, we identified a series of street artists who obviously they didn't have a lot of work, so it was a way to support their work and to bring a bit of life and creativity to these kind of sad boarded up stores in iconic streets in New York City. So here's a couple of examples of the artists at work as a way for Northwell to play a role in the community. Here you can see the artist standing in front of her piece of art. Here's another example as well. And I want to stick with you a sec down, just as we kind of cover a couple of other quick topics before we throw it out to Q&A. One is around this kind of move that we've been through as we're getting people back into healthcare on creating some reassurance and especially, I love this piece here that you created. If you can talk a bit about your strategy.
Yeah, so the first slide you briefly showed is the wear a mask, wash your hands, watch your distance campaign. And I think by now every healthcare system in the world is embracing this. So are we, because that's one of the reasons we're in trouble again. But at the same time, while you're educating people to do everything they can to prevent COVID, we also need to educate everybody to make sure you seek the healthcare you need. Don't delay your healthcare. And obviously, I think all of us, and Jim, you probably have the same thing too, is that people are so afraid of COVID that they avoid the ER, and people die unnecessary from a stroke or a heart attack, and they didn't have to. And that is obviously, if your purpose is to make a positive difference in every life we touch, that those are horrible things to experience in here. So we like others have focused and campaigned on educating people on all the safety measures we're taking. This is a 2-minute story of a patient who underwent a procedure, and we taped him from the very beginning, from when he was booking online at home, reading the visitor policy, all the way through. So we went into the room, we interviewed he was interviewed all along the way when he went to get his COVID pre-testing, and he got the nose swab and then waiting for the results. And then he checked in and said, hey, listen, here are the questions, and here's my temperature, and here's my COVID test result. And then he sat in the waiting room with a 6-foot difference, visualizing everything that we've done, while the patient itself was the narrator of the story. We decided to have the patients talk to their experience rather than our physicians or our CEO or a hired actor. And it's been going well so far, but we just started. This video is probably a week or 2 weeks old. So, yeah, that's what we decided to do, and John was a wonderful narrator through it all.
Yeah, this is on the Piedmont Healthcare YouTube channel. Strongly recommend anyone watch this. It's a brilliant example of helping, I think, to bring to life what the experience is going to be like at every step of the way. So you're creating reassurance, but in such an authentic way, because everything is done, to your point, Douwe, through John's lens.
For those that want to do this, there is a risk. because policies change pretty rapidly. So, one day we allow one visitor, the next day we don't allow visitors. One day this mask is appropriate, and the next day the mask is not appropriate. So there's like a lot of things, like we keep going back to all our videos, like, wait a minute, like, oh, like the one I just showed you with the folks in the parking lot, I would not show today because it kind of undermines our wear a mask. And none of these church prayers, anybody wear a mask, because at that time we were saying, don't wear a mask, save the mask for the healthcare workers. So there's a downside to so keep the production simple and cheap, because you might need to change it rapidly.
Okay, so that's the answer to your own question, which is the way you mitigate for that is it's still worth doing it, even though if it might change, but don't bet the whole house on it, because and be prepared to take it down and put another new one up.
Yeah, and if you're really smart, is shoot different versions. So I think with John we did different versions, like now do one without visitor because we might need that. Do one with the temperature check, but we changed our temperature check. We don't do it manual anymore. We have machines everywhere now, which we installed like this week. So like in the video, he still gets the manual temperature gun, but now it's, I think we taped him doing the electronic ones. But anyway, there's a lot of things that you need to keep an eye on in the execution.
And this is a nice visual, but we always say, Jim, whenever we do these together, that there always has to be one slide or one visual which no one can read and just looks like an Excel chart. So through the form, here it is, and for this presentation, but that tells us the story and the infrastructure and strategy behind the journey mapping work that you did at Hackensack.
Yeah, as we were talking about reopening, and our marketing team was describing the research that we had done and what people were worried about and scared about, I suggested that we do journey mapping for what a consumer experience would be coming back into our health system. Very similar to the story that Douwe just told. And we did ads and things that portrayed similar to what Douwe did, but to make sure we could live up to it, we had a team of infectious disease, clinical, marketing, patient experience, and several others literally walk through every single facility and journey map, can we live up to what we say we're going to do? Where do the masks need to go? Do we need to reduce the number of entries so that we can do temperature checking? We want to make sure that if we're going to tell the community that we're doing it, that we could actually factually live up to that. And so that was the purpose of this. It's not very pretty, but we found gaps in what we were doing, and we solved all those gaps before we put any advertising or communication or promotion out. So if you come in, we live up to this all the time, and we have team members that actually email us or call us if they see something that's out of whack with what we've promised the community, and we fix it right away.
Yeah, what I love about this, Jim, is that you've got the voice of the customer in there, right? And if you were to pretty it up, it could end up looking something like this, where you show all the touch points, and this is an example of how you bring this type of work to life, and actually doing it in a way where it's in a physical environment. This was actually in a shared space, because then anyone from any team could actually come in and look at the actual journey and make recommendations, change things around, add new touch points. So it became, it's a way to take that initial work and make this a living, breathing thing, the importance of journey mapping. And you can do this for different journeys. It's a way to align everyone around the team. I want to share just a couple of other quick examples. Another one from Northwell around how do you apply a bit of kind of creativity, personality, and humanity to some basic things. So here were a couple of different concepts around how you create some of the social distance floor decals. So we kind of looked at things that might be kind of that are about 6 feet width. So again, just because you're doing something highly functional, doing it in a way that where you can still bring some personality and humanity, and do it in a way that's true to your brand. So this was one concept, and kind of how it would look. And it talks about the role of design having function and solving a business problem. This is one that's more towards the staying well, stay kind, and the safety of others as well. Trying to connect it to more of a mindfulness state, because understanding that when consumers are in the system, or they're coming to our facility, they're feeling pretty anxious. I know we have about 9 minutes left, and we have had a question come in from Karen McGuire, who asked, when it comes to human stories going on across the health system, how do you find out about them? Is it something that just happens, or do you have a way of asking employees to share examples of the wonderful actions going on? Jim, I think you touched a little bit on this, on having your culture ambassadors, but maybe you can address this with a bit more detail.
Yeah, we have a couple different ways that we do it. In the height of COVID, where we had a network command center and command centers at each hospital, every day we would hear stories that would come up through the command centers, and we would send our marketing team out to be able to track that down and help tell the story. And then I think one of the best things that we've done, I highly recommend this to anyone that's listening, we created a photo gallery. Everyone's got a camera today. We call it an iPhone or a cell phone. And people were taking pictures, and we asked them to send the pictures in, and we collected the pictures, and we sent out a communication every single day, at least once a day, and in the height of COVID, twice a day, morning and evening, giving everyone facts, updates on PPE, updates on protocols. But we realized we started to tell all our stories in pictures. So we told stories of caregivers. We told the stories of the 100th discharge, the 1000th discharge, etc. And the more that people saw these, the more that they would send in their pictures. So just like Douwe, our community came and they would drive around the hospital, and they would be blowing their horns, and it would be the fire department, the police department, churches, etc., just like it's going on around the country. Everyone captured those pictures, and then we started a gallery, and we share those. But as we started to get the pictures come in, we trace back the stories, and then we pitched the stories to the news media. We told them internally, and used them in many, many different ways.
And if anyone has any more questions, please submit them through the chat. In the meantime, let's kind of talk about the role of systemness as part of this, right? For years, we've been seeing more consolidation within the health system, and we've been talking about the promise of systemness, and we have all kinds of data from, at least from the studies that we've done as well, saying that consumers are indicating that they do have a preference for systemness. But one, I think there's a nuance around that Jim, I'd love you to address, but also then for maybe both of you talk about how the promise of systemness is coming to life during COVID, again, as an accelerant, and what this means going forward.
Yeah, I'm going to start more a little bit inside, and that was, as you consolidate and you add partners, everyone wants to still, like, can I have the capital, but can I stay independent? Can I have the advantages, but can I stay independent? And we've been working really hard to integrate our system over the last 4.5 years. And we really got that hard work. It paid off so amazingly during COVID. We had one central command center connected to all the hospital command centers. So every single day we could move equipment around. We could move ventilators around. We could move drugs around. In fact, some of our hospitals that were being overloaded and just did not have the capacity, we could move patients to another hospital where there was a bed. In our state, the COVID, the infection rate migrated from the north to the south. So Hackensack University Medical Center was like the canary in the coal mine. Everything that happened at that hospital happened a week later in the middle of our state, and happened 2 weeks later south of that. So we were able to see what happened, but also we were able to take staff and nurses from the north and move them up to the south, because we have one epic medical record. All the protocols that were developed by the clinical team on how to treat COVID patients were all embedded into our electronic medical record, so that the types of medications and when you should do proning, all those things came up. So it just proved itself. And the skeptical community hospitals that had wanted, if you will, to remain, quote, independent in some way, all they were saying is, thank goodness we were part of this network. We would have never made it. We wouldn't have had the PPE. In fact, our network loaned or gave N95 masks and gowns and gloves to other standalone hospitals that didn't have them. We were able to help provide them so that they could get through some of this. But by doing that, we started sharing stories, and people realized that they were part of something bigger, and that something bigger served the community just as much as the community hospital did. So I think COVID was a catalyst to actually showing the benefits of integration. One quick other point, the areas that weren't integrated just were outliers. So our occupational health, we had a different in the north and the south, and it really, they're being integrated now, but how we kept statistics and how we knew how many of our team members were out and how long they would be out, we couldn't get those statistics very easily at the beginning, and everyone saw how difficult that was. The laboratories weren't integrated at the beginning, so the ability to get test results and be able to find where the test results could be done the quickest wasn't available at the beginning, but it is now. So I'm a big believer in systemness, and I think that COVID-19 demonstrated that had worked on integration.
Thanks, Jim. I want to end with Carol's story because you have a story that takes systemness even to a next level, which isn't just about your own system, but the opportunity where you can actually collaborate within your own market. If you can, let's just kind of end with that and talk about, I think, the implications, not just related to COVID, but as something that can go live well beyond.
Yeah, so a lot of what Jim shared is also true for Piedmont and the other systems here in Georgia. And the benefits and our learnings are very similar. So I won't repeat those. What we also experienced is one step further is the collaboration across most of the systems. So in Georgia, Emory, Piedmont and Wellstar are the three largest systems. And then Grady is a large hospital in Atlanta where our Trauma 2 Center is, and Children's is the Children's Hospital of Atlanta, to which the other three work very closely with because of the trauma center or because of the children's, being the Children's Hospital. What happened is it started at 2 levels initially. Well, actually 3. First and foremost, the CEOs got together on a regular basis as they were meeting with the governor to provide updates. So that was one level of collaboration, but that was more in education, information, and alignment of like, hey, how we're going to address Georgia with the political leaders, either from the cities or the state. Then the second thing that happened is that the doctors started collaborating and sharing knowledge. Like those who were treating COVID patients, they held webinars, sometimes like 500 physicians would link on, and they were teaching each other on the fly as they would do within the system, but then they decided to broaden it and across the systems. Then the procurement folks got together to align on like, hey, where is the PPE? Where are the vents? Where are the beds? Instead of all bidding against each other and competing with each other, let's make sure that we kind of collaborate. And then if any of the systems was short on anything, while the others had enough, you know, we started sending stuff to each other, whether all the way from PPE to patients. And then at one point, since the collaboration was going well, we transferred that to communication, PR, where our CEOs did a joint op-ed in the largest newspaper here in Georgia. We did a second one about washing your hands, wear your hands. And here, what you see on top of this page, that's an ad that is put your health first. It's an ad that will go out earlier, well, actually this weekend, completely developed by Emory. The Emory CMO sent it out to all the rest of us, like, hey guys, what do you think of this one? My team put this together, you know, are you in? Can we cross-charge? We said, yeah, go ahead. And then Grady came with something else, like we're gonna have a unified wash your hand, wear a mask, and watch your distance iconography, because all 5 of them have our own, which could be confusing. So Grady's developing that. My folks at Piedmont are developing banner ads. Like everybody's doing something, throws it in the group, say, hey, this is the cost, are you in? Can we go ahead? Can we put your name on it? Because our hypothesis and our learning is, if the 5 of us say it together, it's much stronger than each individual.
Again, on how this, oh, there we go. Sorry, Douwe, you're back.
Yes. Oh, sorry. So anyway, we believe that having the 5 of us say the same thing at the same time to the same people resonates more than us doing it individually. At the same time, we're still competing. Like, you know, Piedmont and Emory are competing on transplant. We're competing on cancer. We're competing on cardio. So it's, but I'm talking to my biggest competitor over email probably 2-3 times a week, and we have a weekly meeting. So the people I'm trying to beat in one area, I'm collaborating with the other, and we basically are getting close. As a marketing community, our communication leaders are talking to each other almost daily. Like, hey, what did you make of the last statement of the governor? How are you guys going to respond? Hey, our doctors want to participate in white coats for Black Lives. What are you guys doing? This is what we're doing. And so there's like, so that we as the healthcare providers of Georgia, we are unified where we could and should be unified, and we compete where we could and should be competing.
Yeah, and that's something that you could carry forward into the future.
Yeah, we'll see. We'll see. We are competitors, but for now we're more partners than we're competitors, which is kind of new for all of us.
Right.
But it's working.
Wonderful. Well, look, I think we're a couple of minutes over. Again, I want to thank Douwe and Jim for the participants. We'll be sharing these examples. If you have any other questions or follow-ups, please feel free to send them our way. And just to kind of wrap it up, you'll all be receiving follow-up email as well with details of the 3rd edition of the Humanizing Brand Experience research study with data on 25,000 consumers and ranking of 179 healthcare systems, and based on those kind of 52 markets where we surveyed consumers. Thank you very much for everyone. Thank you again for all the work that you're doing out there, especially Jim and Douwe as well. Please feel free to reach out if anyone has any questions. Thank you so much.